Hi, everyone. My name is Dr. Upal Basu Roy, and I am the Executive Director of Research at Longevity Foundation. We are a lung cancer patient advocacy group based in the United States. And today I'll be presenting the patient perspective on two very important studies that are being presented as a part of the oral abstract session number 20, titled Exploring Treatment Modalities and Tools in Locally Advanced Non-Small Cell Lung Cancer. The first abstract is being presented by Dr. Provencio from the Universidad Autónoma de Madrid in Spain, and the title of his abstract is Long-Term Survival in Operable Stage IIIA Non-Small Cell Lung Cancer Patients Treated with Neoadjuvant Nivolumab plus Chemotherapy, the NADIM study. Traditionally, patients diagnosed with stage IIIA non-small cell lung cancer either receive surgery and chemotherapy, or surgery and radiation, or a combination of chemotherapy and radiation therapy. And in these circumstances, the overall survival at 3 years is around 30%, which basically means that 3 out of 10 patients will be alive after 3 years of their diagnosis. In the NADIM study, what the researchers wanted to test is whether the addition of an immunotherapy chemotherapy combination before surgery improved overall survival. In this study, 41 patients received an immunotherapy, nivolumab, and 2 chemotherapies, carboplatin and paclitaxel, in 3 cycles before they underwent surgery. After surgery, 37 of these patients received adjuvant nivolumab. After the entire study was completed after 36 months, the progression-free survival was around 70%, and the overall survival was around 80%. Now, keep in mind that traditionally, overall survival at 3 years for this population of patients is around 30%. And the data from the NADIM study clearly shows that the addition of neoadjuvant nivolumab and chemotherapy has a clear marked survival advantage over the standard of care. And again, as a patient advocate, I'm incredibly excited to see the results of the NADIM study, and I honestly see this becoming standard of care. Another aspect of the NADIM study was incredibly exciting, where the researchers tested whether a simple blood test measuring circulating tumor DNA or ctDNA was sufficient to measure and understand and identify which patients would respond to neoadjuvant immunotherapy chemotherapy. And the authors found, using their ctDNA test, that in those patients where no ctDNA was detected before surgery were much more likely to respond to the combination of nivolumab and chemotherapy given as a neoadjuvant treatment. And what is even more compelling from the NADIM study is the fact that 2 additional studies that were conducted in the US, the NeoStar study looking at an immunotherapy combination given as neoadjuvant therapy, and Checkmate 816 study, which is a global study, again looking at an immunotherapy chemotherapy combination given as neoadjuvant treatment for stage IIIA patients, produced very similar results. And again, these studies confirm the findings of the NADIM study. And I'm, again, very, very excited about the NADIM study results. And I firmly believe that the use of neoadjuvant immunotherapy chemotherapy will become the standard of care for those patients who've been diagnosed with stage IIIA non-small cell lung cancer and who are eligible for surgery. The second abstract that I'm going to talk about is being presented by Dr. Bakari from Mass General Hospital in Boston, United States. And the title of his talk is Survival of Patients with Persistent N1 or N2 Disease After Induction Therapy for Stage IIIA N2 Non-Small Cell Lung Cancer. Again, to remind everyone, stage IIIA non-small cell lung cancer is typically treated with either chemotherapy plus surgery or radiation therapy plus surgery, and sometimes only chemoradiation. Now, in these circumstances, most of our understanding of how patients respond to these different treatments have come from data that have come from a single institution. In this particular study, what the authors did is they looked at a national database, the National Cancer Database, that aggregates data from all hospitals in the United States, all cancer patients, irrespective of their stage, irrespective of their tissue, and irrespective of their type of treatment. And the National Cancer Database is a very rich source of data to do this kind of analysis. And the authors were particularly interested in finding out what is the outcome, what is the treatment prognosis of patients who've been diagnosed with stage 3A and 2 disease and who've received either chemotherapy and surgery or chemoradiation and surgery. And this is because of the fact that very often it is considered that these patients are not good candidates for surgery. And what the authors found was the addition of surgery to chemotherapy or surgery to chemoradiation had very good outcomes in this patient population. And more importantly, the overall survival in these two treatment arms was approximately 46% to 48%, and much higher than what has been reported in studies from single institutions. So again, reminding us that this approach of combining surgery with chemotherapy or surgery with chemoradiation may be a good treatment option for those patients diagnosed with stage 3A non-small cell lung cancer. And in summary, it was a great pleasure to provide the patient perspective on these two abstracts. And again, I'm very, very excited to see that there's so much research happening in stage 3A non-small cell lung cancer. And again, thank you for the opportunity, and I hope you enjoy the conference.